Hello, my name is Ara Balkan. I'm a practicing pediatrician and the Chief Medical Officer at GIBLIB. I'm excited to provide an overview and product demo of our platform, which we consider to be a masterclass in medical education composed of the highest quality content available. Our value proposition describes this well. GIBLIB is where physicians and advanced practice providers go to learn and earn CME through convenient, on-demand, high-quality educational content created by trusted experts from the world's top hospitals. To give you a sense of how differently we approach medical content, I like to play a sizzle reel that highlights both our clinical quality and our production value.
I've been inspired by technology. How could we take that and apply it to healthcare to improve health outcomes and health economics as vehicles to improve the human condition for all? I'm inspired by the opportunity to better understand the lived life experience of our patients,
to understand the person, the patient, the care they need, and ensure that care is equitable.
However, we cannot forget the people who care for patients. To learn from people based on their stories, to feel empowered, to feel strengthened, to be inspired.
There are so many things that we can learn from others across the globe.
I think what's most spectacular is how resilient the healthcare workforce is. Adversity is constant.
A person's physicality is a very small part of who they are. In the case of another human being, it's all those qualities and experiences that we can't see with our eyes. Give them a chance to tell me, what are they like?
What I've tried to do is really just focus on science and being a really good surgeon, because I think sometimes that speaks louder.
And not pretending to have answers to everything, but always working towards finding those solutions.
So what I hope I've given you today is a sense that the future is bright.
It's not about you anymore. It's all about how to make things better for others.
Our challenge today is to learn from and to collectively create value for all of us.
I hope you saw from that clip how differently we approach content to make it both interesting and engaging. What you see on the left-hand side there is the landing page of our platform. We have over 5,000 videos covering every specialty. We add over 50 new videos every single month. We have 120 complete conferences, and it's a priority of ours to go out and get more conferences because we know physicians have a difficult time making a couple of conferences a year, and it's important for us to put this content on our site so they can go to one site to be able to get the topics they need. All that content leads to over 1,000 hours of CME. It's very easy to do the CME assessments and to pull down your certificate showing your credits. We have a lot of traditional conference-style PowerPoint material, but we also create a lot of the GIBLIB original videos that you saw on the sizzle reel there. Trust is an important component of our work. As a physician, I want to ensure that the content I'm consuming is independent and unbiased, and that's an important principle for GIBLIB as well. We partner with some of the best hospitals in the world, Mayo Clinic, Cleveland Clinic, Stanford, and others, to create this content to ensure that it's clinically relevant, up-to-date, and evidence-based. Convenience is an important principle of ours as well. We want to ensure physicians are able to consume this content at their desk, in the car, on the run, or wherever it's most convenient for them. You can get our content on the web or on an app. Similar to much of the streaming services that we're used to, if you finish a session on one sitting, log back on, it'll prompt you to continue watching the video that you hadn't finished yet. It's also built on a recommendation engine. I'm registered as a pediatrician, so it'll show me top videos that are available for pediatrics or the top videos that other pediatricians are watching. Multiple formats is also an important feature of GIBLIB. You can watch videos of surgeries or presentations. You can listen to audio of lectures or podcasts, or you can read PowerPoints or transcripts. Let's go into a live demo. GIBLIB is built on a recommendation engine from two components, both from the clinical background of what you're registered as and what your specialty is, and also what your viewing history has been. You can search in multiple different ways. One popular way to search is just entering a search term in the search bar here. So let's do that. Searching for opioids will pop up in the first carousel up top, all videos that have opioids in the title. An important feature of ours is the transcription of all our videos to ensure we present the content that's important to you. So the videos below here, I'll give you an example, Frontiers in Addiction Treatment, Pain and Pills, Pain Rehab Reduces Both, doesn't directly mention opioid in the title, but you can see here in orange that opioids was mentioned 76 times. So this would be a video that if we didn't have the transcriptions, you would know it's pertinent to your search and wouldn't be able to see. As you scroll down, there's conferences related to your search regarding opioids. There's courses that we put together here at GIBLIB that we feel are important and related to the search you're looking for. You can also search by specialty in a number of other ways. You can bookmark individual videos to be able to view later. And if we were to go into one of them now.
Again, surgery. And today, I would like to share with you a few concepts about how to manage a complex injury, distal humerus fracture. Let's start by talking about.
So you can see the way we've created this content is by creating a very engaging masterclass style of setting. We overlay graphics onto these presentations as well to ensure that the user is able to see not just the lecture, but any material that the physician wants to bring along in the presentation. On the right there, you can see, much like the YouTube function of watching next, it presents videos to you that you think is relevant to what you watched historically. This is the CME assessment area. I've already completed a CME assessment for this video, and I'll show you in a minute how you can complete those assessments for yourselves. And we have a note-taking feature where you can enter personal notes related to exactly where you're watching on the video. So as you can see here from my past notes, I entered a couple of notes here, neural function testing, refer to this, and when you click on it, it'll go directly to that part of the video. All the videos are transcribed, so you can read through as well, or if you're looking for a specific search term, let's say complication, you can type in that term, and it'll pop up exactly when that's mentioned. You can click on any of those and it'll go directly to that part of the video that it's discussing that. My CME section has videos that you have in progress that you still need to complete the CME assessment on, and it's very simple to do that if you wanted to finish the assessment. It's just a few Likert scale questions and a couple of free text questions, and you can submit that. You can also go to see what you've already completed. You can select individual ones or select all and download the credits showing this, download the certificate showing the credits you've earned, and then be able to send that to whomever you'd like. Playlist is an important feature as well. You can have, as an institution, create playlists, for example, around heart failure that have a bunch of different heart failure videos that you'd like to push out to clinicians. Or you can, as a residency program director, create specific playlists for rotations, such as endocrine rotation, that you're able to send out. So training programs in particular love us because clerkships and residencies and fellowships are able to create these individual playlists proactively to watch during their rotation. And also as a backup, if say a trainee is out in quarantine or isolation due to the pandemic as an example, and they're wondering what they can do while they're out, you can provide for them these playlists. And then we have back-end administrative tracking dashboards that you can see who's watched the playlist, how many of the videos they watched, so you're able to track that. Catalog function is where you can search all of our content, the videos, courses, and conferences. by specialty, subspecialty, organization that created it, content subtype, such as GIBLIB originals or podcasts, which videos are CME accredited, and 360 virtual reality videos. I hope you've been able to see through our product demo the value that physicians and advanced practice providers can get from GIBLIB. We physicians really strongly believe that our content that we consume has to be clinically relevant, up-to-date, and evidence-based. We ensure that at GIBLIB by partnering with the best hospitals in the world to create that content with us. Getting CME that's easy to earn, track, and report out is important, and our convenient process of being able to do that and share that with credentialing or any other regulatory body is clear through the demo. What's important, particularly for institutions that have different generations of learners, are there multiple formats available. And we do have that. You can watch video, you can listen to audio, or you can read the PowerPoints and transcripts. To the organization as a whole, it's important that you serve all the specialties, and we're able to do that. Have every specialty covered. You can also serve your trainees as well through the use of playlists, both for the curriculum that they're on or the clerkships that they're on, as well as if they happen to be out for illness, and they can watch these videos in addition to any supplemental reading that they must do. Many institutions already provide educational content and lectures in CME. GIBLIB can really help complement their offering by filling gaps proactively for topics that are hard to get internally at that organization, or for last-second cancellations. Instead of having to cancel the entire conference, you can get GIBLIB content that's relevant to the subject and fill it in and still be able to provide that educational content to your team. Is there a return on investment financially and non-financially? And we believe there is. Compared with conference registration and travel, for which you still wouldn't be able to complete all your CME requirements for your medical license, GIBLIB is really cost-effective in that manner when you compare it to those other formats. Also, in a non-financial way, we physicians have a lot of demands on our time. We have content that we need to keep up with in our specialty. We have CME requirements that we have to meet for our medical license by every state. And we have hospital-required compliance, billing, safety, quality, harassment training, all these other trainings that we have to do. And we at GIBLIB are really striving to become a one-stop shop to provide all of that on our platform. Thank you for your time as we reviewed the features of GIBLIB and showed you the value that it can provide to physicians, APPs, and to your organization as a whole.